This video will take you through the steps to apply and remove a PROSE device with assistance onto a wearer's eye using a plunger. Always thoroughly wash your hands with non-moisturizing soap and dry them completely with a lint-free towel before you begin. To begin, you will need to set up a clean work surface, which the wearer will be seated in front of, and where you will prepare the device for application. You will also need the following supplies: a soft towel to be placed on top of the work surface, an application plunger, a removal plunger, and preservative-free saline. Only freshly opened preservative-free saline that has been opened for less than 48 hours should be used to fill the device. Marking the bottle of saline with the date it is opened will help remind you when it's time to throw it away. Holding it gently by the edges, apply the clean and disinfected device to the application plunger by gently squeezing the plunger at the line while placing the device on the cup and releasing the squeeze. 1 dot represents the right device and 2 dots represent the left. If 1 or 2 dots are present, orient the device so that the dot will be applied in the 12 o'clock position on the eye. Holding the plunger vertically, overfill the device with preservative-free saline. To prevent bubbles from forming, let the solution drip, not stream into the device. Overfilling will improve the chances of a bubble-free application. Position yourself beside the wearer. If possible, the wearer needs to tuck their chin to their chest and look straight down. Their forehead should be even with their chin and their face parallel to the floor. With your free hand, reach around the top of the wearer's head, resting your forearm on top of the head, and grasp the upper eyelid of the wearer, gently pulling the lid up toward the brow. If the wearer is able, have them pull their lower lid down. Or you can use the middle finger of your hand holding the plunger to pull down the wearer's lower lid. Hold the eyelids at the edge where the lashes meet the lids. The contact points should be centered on both lids to form a perfectly round opening with plenty of clearance for the device. Remember, the eye must be open wide. Begin to approach the eye steadily while instructing the wearer to focus on the black hole in the center of the plunger. The approaching device and plunger must be centered within the lid opening, and the wearer must continue to stare at the black hole in the plunger as if they are looking through it. Some people find it useful to shut the eye that the device is not being applied onto. As the device continues to approach the eye, the wearer will feel the coolness of the fluid. Press the device onto the eye with firm pressure. Capture the device with the eyelids by releasing the lids. Maintain the upward pressure on the device while squeezing the plunger completely to release the plunger. Now check the device in the mirror. Shine a pen light or a mobile phone light at an angle onto the surface and look for the presence of bubbles. If you detect bubbles, the device must be removed and reapplied. Clean the tip of the plunger thoroughly with an alcohol prep pad and allow to air dry completely. Replace your plungers every 3 months. To begin, you will need to have a clean work surface and the following supplies: a soft towel to be placed on top of the work surface, a standard contact lens case, a removal plunger, tissues, and preservative-free saline. Lubricate the wearer's eye thoroughly with several drops of preservative-free saline and then wet a removal plunger with the same saline. Position yourself beside the wearer. Have the wearer pull down their bottom lid. With your free hand, reach around the top of the wearer's head, resting your forearm on the top of their head, and grasp the upper eyelid, gently pulling the lid up toward the brow. Press the plunger firmly at the point where the color portion of the eye meets the white. If the plunger is pressed too close to the center of the device, right over the pupil, it may not be possible to break suction and remove it. If you press too hard, the plunger will bend and you will not be able to grab the device. Break the suction by pulling in an arc-out manner, taking care not to scratch the cornea. Maintain the lid spread until the device is out of the eye. Clean the tip of the plunger thoroughly with an alcohol prep pad and allow to air dry completely. Replace your plungers every 3 months.